Patients who undergo abdominal incisions have pain in those incisions that can be controlled through a number of devices. These can include epidural catheters or patient-controlled analgesic machines, where the patient administers the dose of analgesic for themselves. One of the controversies in SCOAP is how best to follow this metric. For patients who have gastrointestinal surgery with a large incision, the use of an epidural is sometimes considered a best practice. Especially in hospitals that are trying to shorten length of stay, this is often found to improve length of stay. Because SCOAP also monitors length of stay, looking at these two metrics together can be important for colorectal surgical procedures. Almost every hospital agrees, though, that the use of patient-controlled devices is a best practice. And so these two metrics, the use of epidurals when it's an option and the use of patient-controlled analgesic when it's an option, are both monitored through SCOAP. If your hospital is underperforming on these two metrics, it's important that surgeons and anesthesiologists are talking about ways in which these can be achieved. When talking with surgeons and anesthesiologists, it's important that they understand that epidurals can be used in conjunction with blood thinners. It's a bit of a controversy that has been resolved by most anesthesia bodies. And within the SCOAP network, there are best practice hospitals that use epidurals in almost all the cases where it's eligible. Those hospitals also have a decreased length of stay. When talking with administrators, it's important that they understand that this metric has as much to do with the patient's feeling about whether or not they are pain controlled as it has to do with length of stay. Anything that shortens length of stay improves efficiency of the hospital and is better for the hospital's bottom line.